leg is part of the lower limb that lies between the knee and ankle. Dorsum is the back or upper surface of foot. Superficial fascia, superficial veins, cutaneous nerves. Superficial veins. Superficial veins on the dorsum of foot and leg are as under. Dorsal venous arch lies on the dorsum of the foot over the proximal parts of metatarsal bones. Dorsal digital veins. There are two dorsal digital veins in each toe. Each joins to form four dorsal metatarsal vein which terminates in dorsal venous arch. Great saphenous vein. The dorsal digital vein on the medial side of the big toe joins the medial end of the dorsal venous arch to form the great saphenous vein. It passes upwards in front of the medial malleolus, crosses the lower one-third of the medial surface of tibia obliquely, and runs along its medial border to reach the back of the knee. The saphenous nerve runs in front of the great saphenous vein. Small saphenous vein. The dorsal digital vein on the lateral side of the little toe joins the lateral end of the dorsal venous arch to form the small or short saphenous vein. It passes upward behind the lateral malleolus to reach the back of the leg, where sural nerve accompanies it. Both the saphenous veins are connected to the deep veins through the perforating veins. Cutaneous nerves. The cutaneous nerves on the front of the leg are as follows. Infrapatellar branch of the saphenous nerve. It pierces the sartorius and the deep fascia on the medial side of the knee, curves downwards and forward to supply the skin over the ligamentum patellae. Saphenous nerve is a branch of the posterior division of the femoral nerve. It pierces the deep fascia on the medial side of the knee, between the sartorius and gracilis, and runs downward in front of the great saphenous vein. It supplies the skin on the medial side of the leg and medial border of the foot up to the ball of big toe. Lateral cutaneous nerve of calf is a branch of the common peroneal nerve. It pierces the deep fascia over the lateral head of the gastrocnemius and then descends to supply the skin of the upper two-thirds of the leg laterally. Superficial peroneal nerve. It arises from the common peroneal nerve on the lateral side of the neck of the fibula. It pierces the deep fascia at the junction of the upper two-third and lower one-third of the lateral side of the leg, and divides into medial and lateral branches. The superficial peroneal nerve supplies skin over the lower one-third of the lateral side of the leg. Whole of the skin on the dorsum of the foot except for cleft between the first and second toes, which is supplied by deep peroneal nerve. Lateral border of foot, which is supplied by sural nerve. Medial border of the foot up to the ball of the big toe, which is supplied by the saphenous nerve. Deep peroneal nerve terminates by supplying the skin adjoining the cleft between the first and second toes. Sural nerve is a branch of the tibial nerve. It arises in the middle of the popliteal fossa, runs downwards, pierces the deep fascia in the middle of the leg, accompanies the small saphenous vein, and supplies the skin of the lower half of the back of leg and of the whole of the lateral border of the foot up to the tip of the little toe. Digital branches of the medial and lateral plantar nerves curve upwards and supply the distal parts of the dorsum of the toes. Deep fascia of the leg. The deep fascia of the leg is very strong and encloses the leg like a tight sleeve. It does not cover the subcutaneous bony surfaces and is attached to their borders. Extensions of deep fascia form intermuscular septa that divide the leg into compartments. The anterior and posterior intermuscular septa are attached to the anterior and posterior borders of the fibula. They divide the leg into three compartments: anterior, lateral, and posterior. The posterior compartment is subdivided into superficial, intermediate, and deep parts by superficial and deep transverse facial septa. Retinacular. Around the ankle, the deep fascia is thickened to form strong fibrous bands called retinacula. They are so named because they retain the tendons around the ankle in their place. The various retinacula are superior and inferior extensor retinacula on the front of ankle, superior and inferior peroneal retinacula on the lateral side of ankle, flexor retinaculum on the posteromedial aspect of the ankle, superior extensor retinaculum. Attachments. Medially attached to the lower part of the anterior border of tibia. Laterally attached to the lower part of the anterior border of fibula. Inferior extensor retinaculum. This is Y-shaped band of deep fascia situated in front of the ankle joint and posterior part of the dorsum of the foot. The stem of Y lies laterally and the upper and lower bands lie medially. Attachments. The stem of Y is attached to the anterior non-articular part of the superior surface of calcaneum in front of the sulcus calcanei. The upper band of Y passes upwards and medially to be attached to the anterior border of medial malleolus. The lower band of Y passes downwards and medially over foot to fuse with plantar aponeurosis. The anterior compartment from medial to lateral side are as follows: tibialis anterior, extensor hallucis longus, extensor digitorum longus, Peroneus tertius. Artery, anterior tibial artery. Nerve, deep peroneal nerve or anterior tibial nerve. Anterior tibial artery lies medial to the deep peroneal nerve. Both the artery and nerve lie between the tendons of the extensor hallucis longus and the extensor digitorum longus. Anterior or extensor compartment of leg. Boundaries. Anteriorly, deep fascia of leg. Posteriorly, interosseous membrane. Medially, lateral surface of the shaft of the tibia. Laterally, medial surface of fibula and anterior intermuscular septum. Contents. Muscles. Tibialis anterior. Extensor hallucis longus. Extensor digitorum longus. Peroneus tertius. Superior extensor retinaculum. Artery, anterior tibial artery. Nerve, deep peroneal nerve or anterior tibial nerve. Muscles of anterior compartment of leg. Tibialis anterior. It is a spindle-shaped multipennate muscle. Origin. From the lateral condyle of tibia. Upper 2/3 of the lateral surface of the shaft of the tibia and adjoining part of the interosseous membrane. Insertion into the inferomedial surface of the medial cuneiform and the adjoining part of the base of the first metatarsal bone. Nerve supply. It is innervated by the deep peroneal nerve. Actions. Dorsiflexion of foot. Acts as inverter of foot, maintains medial longitudinal arch of the foot acting as a sling from above. Extensor hallucis longus. Origin. From the middle 2/4 of the medial surface of the shaft of the fibula, medial to the extensor digitorum longus and adjoining part of the interosseous membrane. Insertion into dorsal surface of the base of the distal phalanx of the big toe. Nerve supply. It is innervated by the deep peroneal nerve. Actions. Dorsiflexion of great toe. Extensor digitorum longus. Origin. From the upper 3/4 of the medial surface of the shaft of the fibula, lateral condyle of tibia, upper part of interosseous membrane, Insertion. It splits into 4 tendons and each tendon divides into 3 slips. These are a central or axial slip attached to the base of the middle phalanx and 2 collateral or coaxial slips which reunite on the dorsum of the middle phalanx and are attached to the base of the distal phalanx. Nerve supply. It is innervated by the deep peroneal nerve. Actions. It extends the lateral 4 toes, acting synergistically with tibialis anterior, extensor hallucis longus, and fibularis tertius. It is a dorsiflexor of the ankle. Peroneus tertius. It is separated part of extensor digitorum longus and it may be absent. Origin. From lower 1/4 of the medial surface of the shaft of the fibula, adjoining part of interosseous membrane. Insertion into medial part of the dorsal surface of the base of the 5th metatarsal bone. Nerve supply. It is innervated by the deep peroneal nerve. Actions. Dorsiflexion of ankle joint acts as a weak averter of foot. Anterior tibial artery. This is the main artery of the anterior compartment of the leg. The blood supply to the anterior compartment of the leg is reinforced by the perforating branch of the peroneal artery, the size of which is inversely proportional to the anterior tibial artery. Origin. The anterior tibial artery is the smaller terminal branch of the popliteal artery given at the lower border of the popliteus muscle. Course. It begins on the back of the leg at the lower border of the popliteus. It enters the anterior compartment of the leg by passing forward between the 2 heads of the tibialis posterior through an opening in the upper part of the interosseous membrane and runs in front of it. In the anterior compartment, it runs vertically downward to a point midway between the medial and lateral malleoli, where it enters the foot and changes its name to dorsalis pedis artery. Relations. Behind. Interosseous membrane in the upper 2/3 and ankle joint in the lower part. In front. In the upper 1/3 of the leg, it lies between the tibialis anterior and extensor digitorum longus. In the middle 1/3 of the leg, it lies between the tibialis anterior and extensor hallucis longus. In the lower 1/3 of the leg, it lies between extensor digitorum longus and extensor hallucis longus. The deep peroneal nerve is lateral to it in its upper 1/3 and lower 1/3 and anterior to it in its middle 1/3. Branches. Posterior tibial recurrent arteries. It ascends anterior to popliteus, with the recurrent nerve to that muscle, anastomosing with the inferior genicular branches of the popliteal artery. It supplies the superior tibiofibular joint, anterior tibial recurrent artery. It ascends in tibialis anterior, ramifies on the front and sides of the knee joint and joins the patellar network, anastomosing with the genicular branches of the popliteal and circumflex fibular arteries. Muscular branches to adjacent muscles. Lateral malleolar arteries and medial malleolar arteries. They take part in the anastomosis around the ankle joint. Deep peroneal nerve or anterior tibial nerve. It is the nerve of the anterior compartment of the leg and dorsum of the foot. It corresponds to the posterior interosseous nerve of the forearm. Origin. It is one of the two terminal branches of the common peroneal nerve at the neck of the fibula. Course and relations. It begins on the lateral side of the neck of fibula under cover of the upper fibers of peroneus longus muscle. It spirals around the neck of the fibula and enters the anterior compartment of the leg by piercing the anterior intermuscular septum. It pierces extensor digitorum longus and accompanies the anterior tibial artery. The nerve lies lateral to the artery in the upper and lower thirds of the leg and anterior to the artery in the middle one-third. The nerve ends in front of the ankle by dividing into the lateral and medial terminal branches. The lateral terminal branch runs laterally and ends in a pseudoganglion deep to the extensor digitorum brevis by supplying the extensor digitorum brevis and tarsal and metatarsal joints on the lateral side of the foot. The medial terminal branch ends by supplying the skin adjoining the first interdigital cleft, the proximal joints of the big toe, and often the first dorsal interosseous muscle. Branches and distribution. Muscular branches supply the muscles of anterior compartment of the leg, the extensor digitorum brevis on the dorsum of the foot, first and second dorsal interossi. Cutaneous branch supply adjacent sides of the first and second toes. Articular branches supply ankle joint, tarsal joints, tarso-metatarsal joint, and tarsophalangeal joint of the big toe. Extensor digitorum brevis. This is a small muscle situated on the lateral part of the dorsum of foot, deep to the tendons of the extensor digitorum longus. Origin. It arises from anterior part of the superior surface of the calcaneum, deep surface of the stem of the extensor retinaculum, and the interosseous talocalcanean ligament. Insertion. The muscle divides into 4 tendons for the medial 4 toes. The medial-most part of the muscle, which is distinct, is known as extensor hallucis brevis. The extensor hallucis brevis is inserted into the dorsal surface of the base of the proximal phalanx of the great toe. The lateral three tendons join the lateral sides of the tendons of the extensor digitorum longus to form the dorsal digital expansion for the second, third, and fourth toes. Nerve supply. Lateral terminal branch of deep peroneal nerve. Actions. The extensor hallucis brevis extends the metatarsophalangeal joint of the great toe. The three tendons extend the metatarsophalangeal and interphalangeal joints of the second, third, and fourth toes, particularly in a dorsiflexed foot. Dorsalis pedis artery. It is the chief artery of the dorsum of the foot. Origin. It is a continuation of the anterior tibial artery on the dorsum of the foot in front of the ankle. Course. The artery begins in front of the ankle between the two malleoli. It passes along the medial side of the dorsum of the foot to reach the proximal end of the first intermetatarsal space. Here, it dips downwards between the two heads of the first dorsal interosseous muscle and ends in the sole by joining the deep branch of the lateral plantar artery, completing the plantar arterial arch. Relations. Superficial. Skin, fasciae, and inferior extensor retinaculum. Extensor hallucis brevis crosses the artery superficially from the lateral to medial side. Deep. Capsular ligament of the ankle joint. Talus, navicular and intermediate cuneiform bones, and the ligaments connecting them. Medial. Extensor hallucis longus. Lateral. First tendon of the extensor digitorum longus. The medial terminal branch of the deep peroneal nerve. Branches. The lateral tarsal arteries and medial tarsal arteries. They take part in the formation of lateral and medial malleolar arterial networks. Arcuate artery. It arises near the base of the second metatarsal and runs laterally to reach the lateral edge of the foot. It gives three dorsal metatarsal arteries, each of which divides into two dorsal arteries for the lateral four toes. The lateral one sends a twig to the lateral side of the little toe. Proximally, in the interosseous spaces, these branches receive proximal perforating branches from the plantar arch. Distally, they are joined by distal perforating branches from the plantar metatarsal arteries. The fourth dorsal metatarsal artery sends a branch to the lateral side of the fifth toe. First dorsal metatarsal artery arises just before the dorsalis pedis artery dips into the sole of foot. It gives a branch of the medial side of the big toe and divides into dorsal digital branches for adjacent sides of the first and second toes.